Who would have imagined that a pediatric oncologist, a professional football team, and a corporation such as McDonald's would have formed a partnership that would forever change the face of family-centered pediatric care? The American College of Critical Care Medicine Task Force defines family-centered pediatric care as an approach to healthcare that ensures a strong partnership and working relationship among patients, families, physicians, and other healthcare professionals. During the 1960s and early 70s, Dr. Audrey Evans, a pediatric oncologist at Children's Hospital of Philadelphia, had witnessed the exhausted and emotionally drained state in which parents tried to function in order to be near their critically ill children. All of the children receiving cancer treatment in these wards and their parents came from quite a distance to the Children's Hospital of Philadelphia, says Dr. Evans. They were worn out from the stress and the lengthy journeys. They would put their heads down to rest right at their children's bed.
If you're in one of the old-fashioned wards where you had the iron bedsteads and the locker beside one side and the chair the other side in a row of beds, there wasn't any very comfortable to stay, and some of the people wanted to stay overnight. So we thought we needed somewhere that was more like home, more comforting for them to stay.
During the early 1970s, as Dr. Evans and her oncology team prepared to move to a new building, Philadelphia Eagles tight end Fred Hill and his wife Fran were at Philadelphia's St. Christopher's Hospital with their 3-year-old daughter Kim, who was struggling with a rare form of childhood leukemia. As Kim's condition began to improve, Fred Hill knew he wanted to find a way to help raise funding that would in some way offer support to other families going through what his family had experienced. With the support of the Eagles' general manager, Jim Murray, Fred Hill and his teammates held a fundraiser with the intent that the money should help in the fight against childhood cancer.
Well, it was very simple. They had a daughter who's still with us, Kim, who's my hero, and she was diagnosed with leukemia and staying at St. Christopher's Hospital. Her doctor was a guy named Laurie Neiman, and we had a big event.
It was decided that the $100,000 raised by the Eagles would be donated to Dr. Evans at Children's Hospital of Philadelphia to be used for a special air filtration system to ensure that the new oncology wing had sanitary air properly circulating. Jim Murray still laughs that Dr. Evans is the only woman to whom he ever gave $100,000, only to be asked immediately for more. Murray liked Evans' idea for a home away from home. Dr. Evans knew all too well that if there were a home-like setting in which these worried and exhausted parents could rest and receive a home-cooked meal, they would be less stressed and better able to participate in the care of their children.
Well, why didn't we make it a little bit more? Why don't we try and have a home and with people living in it as a home, and then who took in more like a B&B. And so that's what we set out to do.
Murray then approached Don Tuckerman of the Philadelphia McDonald's ad agency to help raise funds for such a place. Through their sale of their Shamrock Shakes, McDonald's and the Philadelphia Eagles raised the funds to purchase what would become the world's first Ronald McDonald House. And on October 15, 1974, Ronald McDonald House on Chestnut Street in downtown Philadelphia first opened its doors and its heart.
I didn't dream that it would be as good as it was. It was beyond my my plans that it worked.
It became, a beautiful miracle because her heart wasn't the money, it was unlimited resources to help kids.
Today, the impact of Ronald McDonald House is felt in family-centered pediatric hospitals throughout the world, with nearly 300 houses serving children and their families in 52 countries around the globe. Today, doctors, families, researchers, and medical specialists attest to the vital role Ronald McDonald House plays in family-centered care.
Every hospital that treats children from a distance with serious disease benefits from having a home away from home nearby.
The single most significant thing is that the Ronald McDonald House not only provides a home away from home, which has been said many times, but it really saves the family. And I think that's the biggest impact.
But it certainly makes the whole thing far more tolerable than being alone in a big institution with nothing but hospital beds and busy staff and nowhere to sit except maybe one sitting room in the middle of the ward. So to have a place to go that is not a hotel but has people in it that are in the same situation as you makes, and perhaps parents' peace of mind does help. Well, I think it helps in healing, because healing has to be both the body and the mind.
Dr. Mark Levitt, Assistant Director of the world's only pediatric colorectal center, located at Cincinnati Children's Hospital Medical Center, also attests to the contributions Ronald McDonald House makes to family-centered care. We see better rested, less stressed, more cooperative parents as a result of Ronald McDonald House. I wish every family could be a Ronald McDonald House family. So often, a child's best or only hope for survival is medical care hundreds or even thousands of miles away from home. Without a safe, affordable home away from home, most parents would not be able to afford a place to live while their children receive medical care. Dr. John Fayetta, professor of pediatrics at Duke University, stresses that because of Ronald McDonald House and its relationships with the medical community, we can help eliminate many of the barriers that prevent families of ill and injured children from getting the care their children need. To help improve the health and well-being of children around the world, we rely on strong partnerships with the medical community. Because Ronald McDonald House families all share a common goal, relationships form naturally, friendships are made, and support is offered.
And the sharing that parents do at the McDonald House, I think, is very valuable.
This sort of supportive atmosphere, even if money were no object, would not exist in a hotel. In a hotel, a family is more isolated, with no sense of community. Jeffrey, a Ronald McDonald House cancer patient, says that, "When I had to stay in a hotel, I would open the door and see empty hallways. There was no one to play with, but at Ronald McDonald House each day, I opened my door and knew I had friends to play with and things to do." You stay in a hotel, but you live in a Ronald McDonald House.
In a really home-like atmosphere. And anybody could see that that was so much better than a hotel where people would be alone.
More than anything, Ronald McDonald House offers a sense of normalcy to a world turned upside down. And according to Dr. Fayetta, caring for the family and creating a sense of normalcy is invaluable. The approximation of normalcy permits a child to focus energy on a calm, safe recovery, not on fear or coping with uncertainty. There isn't an organization I am aware of that focuses on the whole family like Ronald McDonald House. It was so innovative when it started out, and it still is. When asked to look back to 1974 and consider how innovative her idea of a home away from home was, Dr. Audrey Evans says simply but proudly, "Very innovative."
Well, it was a complete original, so it was the first, and in which case I think that was very innovative.
You talk about innovative, a football team, a tremendous company like McDonald's, and people who really need help. So I think that was as innovative a trifecta as you can get. That was a real trinity.